All right. I'm sorry. I'm just told that I was on mute, so I apologize for that. Um, I want to start by, really uh, thinking about where this country is as it relates to um, communities of color and policing of those communities, in particular, Black men and women, and how many are treated and how many feel they are perceived. It is an issue that I have discussed numerous times with Montgomery Police Chief Ernest Finley, and it's an issue that we are constantly trying to get our arms around and figure out how we can do better in this area here in Montgomery so that we do not relive some of the mistakes of the past. And those mistakes have happened not only here in Montgomery, but they've happened in this country far too often, in particular when it comes to Black men. That is an issue that we all have to face. It's an issue that we all have to work to try to solve. It's an issue that we all have to acknowledge, even if it means having uncomfortable conversations, even if it means having some different disagreements about how we achieve progress in that space. I am just a few blocks from the National Memorial for Peace and Justice, which was erected by the Equal Justice Initiative. That memorial is dedicated to victims of lynchings in this country. And it takes place over centuries, over many states in this country. And what we witnessed, for those who watched the video, was nothing short of just that. It was a lynching. And it was something that did not and should not have happened. And so when we think about where we are right now in this country, we must think about how we reduce and eliminate the minds and the actions that lead to those outcomes, because there's no bringing George Floyd back. There's no chance to hit rewind or reset where that's concerned. And I think this country has to look itself in the mirror, and certainly all of us in positions of leadership have to look ourselves in the mirror to discern whether or not we're doing everything that we can to prevent those types of incidents from happening, and to make sure that we learn from those that do take place so that they don't impact other communities, and more importantly, other people and their families. And so my thoughts and my prayers are with the family of George Floyd, the community of Minneapolis, St. Paul, and the rest of this nation as we deal and try to address and come to terms with another incident such as this. I want to turn the page now very briefly to an issue that is also touching the rest of the nation, and that is the COVID-19 pandemic. It is something that continues to impact this community in a way that we would all rather be in the past. However, because we have seen an unprecedented surge in Montgomery, we have now vaulted to one of the top 5 cities for increases in COVID-19 cases throughout this country. We have had a 300% increase in cases month over month. We started off the first 3 weeks of this month with a 40% week over week increase. That dropped down somewhat in the 4th week of this month to less than 30%. I'm sorry, to 30%. And we are hovering right around that number as we closed this week. So it's important that we understand where we are right now as it relates to the COVID-19 pandemic. We're in a crisis. We have less than 5% of ICU beds that are dedicated ICU beds available in our hospitals. While there is availability among hospital beds, we do have a situation and circumstance that is really problematic for our entire healthcare system, whether you suffer from the COVID-19 virus or anything else. It is something that we have to be honest about and be transparent and truthful about, and make sure that we don't make worse, or we don't address before we get to a point of no return. And so we wanted to bring attention to this issue at the request of our hospital administrators, that we make the public aware of just where we are. Now, the hospitals can still see sick patients. If you have an illness or an ailment and you need to go to the ER, you can be accepted there. So we want to make that very clear. The problem is that we're getting very close to our capacity of COVID-19 cases and ICU capability of helping people with acute illnesses and ailments. So we want to think about what that domino effect is. And one thing we can do here in this community is we can make sure that here we're staying at home as much as possible. We're wearing our masks when in public, and we're following the social distancing guidelines that the Centers for Disease Control and Prevention has issued. We want to make sure that we're doing everything we can not to rush this process, which in turn will slow the progress of us fully reopening our economy. I fully understand and fully respect and appreciate the interest to reopen our economy and to give people back to work and to make sure that there are jobs available for them, and that we can do what we can to keep the doors open and the lights on for many small businesses across this community. However, we've taken a big risk in doing that at the rate that we have over the last few weeks. And unfortunately, I think we're suffering because of that. Montgomery is not the only place that has seen a surge in Alabama. We've seen it in other parts of this state. And as we continue to see people get sick, as we continue to see them come into the hospital in worse condition, as we continue to see them die, that is something that we must be aware of, and something we must take affirmative action to try to minimize and address in every way we can. And we're doing that here with the city. We want to keep in mind those healthcare professionals who are also putting their lives at risk. We want to also make sure we're keeping an eye on those frontline workers who are putting their lives at risk. This is not just about who does not get infected. This is not just about the positive recovery rates that exist. Certainly they do, and we're prayerful and grateful for those. However, we must keep in mind that the people that we expose to risk by our own behavior, and we don't know who that may be given our asymptomatic cases that may be out there, and other ways that this virus impacts one, but maybe not the other. Does that mean we stay in a perpetual state of closure? No, it does not. Does that mean that we stay in a perpetual state of being frozen in our economy? It does not. It only means that we move with precaution, and that we let the science and the data guide us on what it is that we are doing. We have to be aware of that, and we have to make sure that we're doing everything that we can to be guided by that information, irrespective of our own desires. Just a point of personal privilege. If you had asked me 6 weeks ago, I would have shared with you privately that I thought that we would be back open in full by June the 1st. I don't think that's going to happen. I think a number of organizations and entities across this country would have had that as an ideal date, but have now adjusting their preparations and their actions because of the data, because of the evidence that we have as leaders. And it's up to us to make decisions sometimes that people don't agree with and sometimes that people don't understand. And that's why you have people in positions such as this who can make the tough calls. And those are the calls that we've had to make, and those are the calls we're going to have to continue to make until we see our cases plateau and we see some reduction in the numbers consistently that we have seen trend upward over these last 3 to 4 weeks. So with that, I certainly hope that we can get to a place where we can open back up sooner rather than later. I have some dates in my head that I would love to share with you, but ultimately we're going to have to make those decisions based on the information that we have from the Department of Public Health, from our hospital partners, and from this community. In the end, it's up to us to beat the virus, but we have not beat it yet. And so I want to conclude just by sharing with you that we're in a tough time in this country right now. There is no way to get around it, but we must and we will get through it. And we'll get through it together, but we have to be honest. We have to have the conversations around not just racial disparities in criminal justice, but also racial disparities in access to healthcare. Those are things that are continuing to weigh down the progress of this country, as well as the city of Montgomery. And we want to do everything that we can to work together, to listen to one another, and to speak with one another about ways that we can improve circumstances here in this state and beyond. Because as Montgomery has always been, it has been a place that has started some great things. It has been an origination point, and it has been a point where people from all backgrounds have had the courage and have had the ability to collaborate together to bring about progress. And we're in that place once again, and I believe we'll do that once more. So with that said, I will conclude my remarks, and if there are any questions that you may have, I will take those at this time. All right, I'm going to have to go to the glasses. All right. Okay. Why has the curfew for Montgomery not been lifted, but every surrounding area has lifted theirs? That's a great question, and it's something that I wonder why surrounding areas have lifted theirs, just to be blunt with you. The numbers and the data that I think should have guided us to a curfew to slow the spread of coronavirus still exists. It is probably worse now than it was when we issued the curfews. I think people have COVID fatigue. I do as well. I think it's very expedient to lift the curfews. But when you're seeing the numbers spike that we're seeing here in Montgomery, we're not in a position to do that. We're not in position to allow people to gather together in various places amongst larger groups when we're seeing numbers spike the way they are, and we're seeing the number of COVID cases come in. Our healthcare system cannot handle that. And ironically, some of the surrounding areas may not be aware of the data that we have, but it's available at the Alabama Department of Public Health, and maybe it's something they should take a look at, because the city of Montgomery is going to bear the brunt of any mistakes that happen in their communities, because we are this region's healthcare and trauma center, and those people that have any issues are coming here to our rooms, are coming here to our hospitals. And so for us, what I would like to see is a plateauing of the COVID ID numbers, as well as some reduction in those numbers as well. And then we will most certainly look at lifting the curfew as soon as we can. Are you considering making it mandatory to wear masks throughout Montgomery? We are considering that. We've been talking about that for a number of weeks. Again, I don't go from encouragement to enforcement very easy. If you go back to March, I was wearing masks in public, and we were encouraging people to wear masks when going out in public. And so we've tried to encourage just to kind of balance a little bit of that enforcement like we have with the curfew. So I don't go to the enforcement stage very easy, but we're at that point right now where we are considering it. And it is something that I expect to talk with our city council about because that may be necessary in order for us to reduce the spread of COVID-19 so that we can maybe see some progress in our case numbers and ultimately get back to a place where things can be moving a little bit smoother and a little bit freer than they are right now. Last question. What numbers will cause you all to visit the shelter in place for Montgomery? Well, we cannot issue a shelter in place locally. The governor is the only authority that can do that. Jefferson County and Mobile County operate under a different set of guidelines because of the class municipality that they are. So they have more freedom, which is why they have their own independent Department of Public Health relative to Montgomery and the rest of the counties in this state. And the ability, I should say, with their county, we all have counties we all have a Department of Public Health. We do not have the authorization that Jefferson and Mobile County has due to the Code of Alabama. So that is statutorily written that Jefferson County, Mobile County have certain levels of authority that they can use that Montgomery County cannot. And so we cannot issue a shelter in place order. I've had people who've asked about a longer curfew as a way to slow the spread. That's something that we thought about and we evaluate and we assess even in March at the start of this pandemic. So we're not in a place to do that. Only the governor can issue a shelter in place order as it relates to Montgomery County, the River Region, and Central Alabama. Well, listen, with that said, I want to thank you for, again, joining us. We're going to keep this short since I want to just come to you directly with a couple of heavy issues that are not only impacting the country, but impact this community as well. I want us to always be transparent and truthful with one another. We may not agree. We may not like what is said, but we always want to make sure that there's a space to really have open and honest dialogue. And I think by doing that, we can really move progress in the right direction. And hopefully, from this standpoint, we can continue to have conversations. We can work together as a community to address the ills, not only of the country, but certainly some of the challenges that we face right here at home. And we want to continue to do that by working together. We've done a fantastic job throughout this COVID-19 pandemic of doing that. We want to continue to work with one another to look out for our friends, neighbors, and loved ones. And we also want to make sure that, we are keeping in mind the broader prospects of this country. Again, Montgomery tends to be a barometer. Montgomery tends to be a thermostat for the country. So we want to make sure that as we protest injustice, we keep in mind those who did it here so many years, so many decades in this community and did it nonviolently, did it with structure, did it with strategy and intent to let those people in power understand what their issues were and what their solutions to those issues could be. And I think that's how we have to keep in mind as we go forward all of the challenges that we face right now is staying together, working together, understanding that only through that lens, only through that mindset can we truly get the progress that we would like to see, and can we truly honor those who have fought so valiantly for us to have the opportunities that we have right now. So thanks again for joining us. And again, my prayers are with the family of George Floyd, the city and community of Minneapolis, St. Paul, Minnesota, Montgomery, Alabama, and certainly the entire United States as we come to grips with some of the challenges that are still before us when it comes to equality and equity in this country, and let's figure out together how we can make this place much better for us and future generations ahead. Thank you so much.